We're the Duluth Deli, and we're here to discuss the BW case. BW is a 23-year-old male living in Minnesota that received a lower back injury due to shoveling his driveway. He presents himself to the pharmacy needing advice for treatment of his lower back pain and inflammation from the pharmacist.
Our patient is a 23-year-old male experiencing lower back pain with inflammation due to shoveling. He reports his pain level as a 4 out of 10. BW has no known drug allergies or adverse drug reactions. He is currently not taking any medications, and he has not tried anything to treat his current back pain. And the patient reported that his father has stage 3 chronic kidney disease. There were no objective pieces of information obtained in this case.
Based on the information we've obtained from BW, we would like to know some additional information. First, we would like to determine his alcohol, caffeine, and social drug use. And it would also be important for us to obtain additional medical history about the possibility of having kidney disease, any other medical history, and if his immunizations are up to date.
Indication and goals of therapy. We gave BW an indication of back pain due to inflammation. For a short-term goal of therapy, we decided to reduce BW's back pain from a pain level of 4 out of 10 to 0 out of 10 over a time period of 1 day. And for a long-term goal of therapy, we want to reduce pain and inflammation from 4 out of 10 to 0 out of 10 for BW indefinitely.
BW has no known drug allergies, no known alerts, and is not currently taking any medications. We did not ask BW about his cultural, religious, or ethical beliefs that might interfere with his medication experience.
The drug therapy problem for BW is he needs additional drug therapy to control his untreated back pain and inflammation, and we have 2 therapeutic options for him. The first one is ibuprofen 200 mg tablet, and the second one is naproxen 220 mg tablet.
Out of the 2 therapeutic options that we had, we chose naproxen 220 mg tablets. We chose naproxen due to the convenience of the patient having to take less tablets per the same amount of time. BW will take 1 tablet by mouth every 12 hours as needed for back pain. He'll make sure to take this with food in order to decrease the chance of GI upset. BW should experience pain relief within 1 to 2 hours, and he should make sure not to take any additional over-the-counter medications like ibuprofen. BW should not take more than 3 tablets per day. He should be aware of blood in the stools, and if this occurs, he should stop the medication and contact his doctor immediately. BW should not use this medication for more than 10 days, and if he is still experiencing pain after 10 days, he should contact his doctor.
Patients experiencing lower back pain similar to BW should follow the RICE model in addition to medication to optimize therapy. This includes rest, icing the lower back, applying compression as well as elevation. For BW, we would suggest reduced physical activity and avoid lifting heavy objects for 10 days, while continuing his icing therapy and to try to stay off his feet when possible. Due to the presence of inflammation, it is recommended that BW does not apply heat to his lower back, as this can make the inflammation worse.
We would do both of our follow-ups by phone. The first follow-up for safety and effectiveness would be 1 day after the encounter to line up with our goal of therapy, to make sure that he's not feeling any of those side effects and make sure that the medication's actually doing what it's supposed to. The next follow-up would be 1 week after the encounter, make sure that the medication's still working, that he's still not having any side effects. We would also evaluate how he's adhering to the regimen, and we would counsel him at that point about not taking the medication for longer than 10 days and to seek medical attention if he continues to have pain or if he has any sort of cardiac complications.
These are the references we used. Thank you for taking time to listen to our presentation today.